Now, this map shows where infection rates have been concentrated in England since the start of the epidemic, but it only gives a partial picture because it doesn't include people tested in the community. Now, Public Health England is watching the increase in infections in a number of other places, but it's worth stressing they haven't recorded anywhere near the same numbers as Leicester, and these certainly are not lists of areas facing imminent lockdown. And if you look at the data for Leicester, you see why. The 7-day infection rate in Leicester, using both hospital and community testing, is 135 cases per 100,000 people, which is 3 times higher than the next highest city. The Labour leader Keir Starmer has accused the government of failing the city by not providing testing data more quickly.
They had data for Pillar 1 COVID tests. That's NHS, care workers and tests in hospitals. They didn't have Pillar 2 tests, the wider tests in the community. Now, that may sound technical, but what that meant was that the local authority thought there were 80 positive tests in the last fortnight, when the real figure was 944. The local authority was only given the real figure last Thursday. So there was a lost week.
So it all boils down to which figures are looked at. Leicester was identified using local data from what's called Pillar 1, mainly hospital testing, and Pillar 2, testing done in the community. So once you factor in the latest figures based on both Pillars 1 and 2, they show that Bradford, Barnsley and Rochdale came closest to Leicester with 45 or more cases per 100,000 people. But that's still quite a long way behind Leicester.
So if we did need to do a second lockdown, we could. We've obviously done it before, but obviously nobody wants that to happen. We have daily conversations with Public Health England, who are not advising of a second lockdown at the moment. Our cases, as we speak, are going down day by day, but they're still higher than anybody would like. And therefore, we need to redouble our efforts and make sure they go down more and to actually help people stay safe.
Now, at the moment, Public Health England doesn't publish daily figures from community testing by local authority, but that's where 3/4 of infections are now being identified. And that's why this data will be critical to spotting other hotspots and potential local lockdowns.